I'm just going to do another short video about another favorite rant of mine um, that I that I think people need to really think about. There's just far too many procedures being performed for circulation problems, and it's it's financial, unfortunately. Uh, um, I saw a patient today who came for about an hour and a half away from us for a second opinion. She had seen her interventional physician, let's just put it that way, interventional physician. And it was recommended to her, well, her symptoms were swelling of the legs. So swelling of the legs, we always think about vein problems. Or medication, all those things we discussed in previous videos about swelling. But it was recommended to her that she have an angiogram, uh, a study of her arterial blood flow, the blood flow down to her legs, um, to treat that rather than the swelling issues. Now, she had absolutely no symptoms from arterial problems. Her blood flow down to her legs, physical examination was normal. The pulse examination was normal. She denies symptoms of intermittent claudication, which is tightness in the calf muscle when you walk, as we discussed in previous videos. She had no history of wound healing issues, no history of what's called critical limb ischemia, pain in the toes at nighttime, ulcers that don't heal up, conditions where you're at risk for losing a lower extremity. None of these symptoms whatsoever, based on her non-invasive testing, which we need to talk about sometime, and her ankle brachial index, which is a measure of her ankle pressure to her arm pressure, was 0.93, which is abnormal, give it, mildly abnormal, but she had no symptoms whatsoever from her arterial circulation. And it was recommended to her that she have an angiogram to fix her arterial circulation in her legs. The problem with this approach is this, folks, that people who don't have any symptoms, who go through these procedures, have a higher risk for losing a leg. Higher risk for losing a leg. It happens. It's happened before. It's pretty well documented that people who don't have symptoms should not go through procedures for this stuff. It's the American Heart Association guidelines, the Society of Vascular Surgery guidelines. They all recommend against intervention for asymptomatic peripheral vascular disease. And to do a procedure on this person, probably in an office-based lab, in my estimation, is just purely for financial gain. And I'm sorry, but you put people at risk for losing legs. So long and short of it is, we talked about her swelling. She has venous reflux, no doubt about it. I tried to talk to her about, being conservative. She's tried to wear support stockings. She's trying to be effective. The problem is she's a server. She's a waitress. She's on her feet all day. And at the end of the day, her leg just kills her. She's got similar problems in both legs, the right side and left side, but one side is worse than the right. And I told her, look, if you want to do something, let's just do one leg only. Let's just do the ablation of the vein. The swelling was in the outside part of her ankle. And so that's the lesser saphenous vein. That's the lesser saphenous vein that goes from the back of the knee down to the outside part of the ankle. We're just going to laser that vein closed, or actually radio frequency that vein closed, and help her with the swelling. I told her, look, we can do this for you, but somewhere down the line, you're probably going to get more swelling issues. She's a relatively young woman. So you're going to get some more swelling issues because of your occupational issues. And so, really consider it. But she feels it's really limiting the quality of her life and her normal activities, daily living. And she's tried to wear support stockings, medical grade support stockings. Fine, let's do it. But all that to say, when people are recommending angiograms for arterial problems, they better be for the right reason. There's very clear-cut indications and guidelines. And I'm afraid that most patients don't really understand that, and they go through procedures that are dubious at best in terms of indication.